Mr. Speaker, for 5 months this Congress has debated how best to address the looming crises of our national deficit. While the debate has often been partisan and polarized, one thing Democrats and Republicans agree on is that addressing our national health care expenditures is a critical part of the solution. A major component of the escalating health care costs in this country is maternity care. The cost of maternity care for mother and child in the U.S. is more than double that of any country in the world. But despite the exorbitant amount of money we spend on maternity care, the U.S. ranks far behind nearly all developed countries in maternal and infant outcomes. Sadly, childbirth continues to have significant risks for mothers and babies, especially in communities of color. Many factors contribute to these poor outcomes and high costs. The most disturbing by far is the fact that there is a vast body of knowledge regarding best evidence-based maternity care, yet current U.S. practice does not follow that research. This results in the widespread overuse of maternity procedures, including cesarean sections and scheduled inductions, which credible evidence tells us are beneficial only in limited situations. Unfortunately, the overuse of these practices results in longer maternity hospital stays and multiple costly procedures that contribute to making combined mother and infant childbirth charges our most costly hospital and Medicaid expenditures. To address these poor outcomes and high costs, today I am introducing the Maximum Optimal Maternity Services for the 21st Century Act. The Moms for the 21st Century Act will create a national focus on optimal maternity care by establishing an interagency coordinating committee to ensure federal agencies are promoting the best evidence-based maternity practices in their programs. The bill also authorizes an extensive media campaign to educate consumers on how to achieve the healthiest maternity outcomes, including the importance of maternity practices such as smoking cessation programs in pregnancy and group model prenatal care. These and other non-invasive practices have been shown to produce considerable improvement in outcomes with no detrimental side effects, but regrettably, they are significantly underused in this country. Furthermore, the bill will expand research on best maternity practices and will direct collection of data on maternity shortage areas. It will also facilitate the development of more interdisciplinary maternity care workforce by bringing together maternity care providers to develop core curricula across maternity professional disciplines, and it establishes a loan repayment program for maternity care providers who commit to work in underserved areas. Finally, the Moms for the 21st Century Act will support the education of a more culturally and linguistically diverse workforce by authorizing grant programs for maternity professional organizations to recruit and retain minority providers. Mr. Speaker, we can and we must do better for mothers and newborns. As a country, we must reach beyond our self-imposed boundaries to embrace and prioritize an evidence-based model of maternity care that will save lives and save money. I urge my colleagues to join me in this effort by co-sponsoring and helping to pass the Moms for the 21st Century Act. I yield back the balance of my time.
The gentlewoman yields back. The chair